Hi, I'm Dr. Shalini. I'm a hair transplant surgeon and a consultant dermatologist practicing in New Delhi. A common question which patients have in their mind when they come to me to consult for a hair transplant surgery is that how many grafts can we extract in a single sitting? Well, a patient who has a bald area which extends from the top till the crown, that comes under grade 5 or grade 6 level of baldness, that is an advanced level of baldness. They generally have this expectation that in one sitting their full scalp gets covered after a hair transplant surgery. They come and tell me, the doctor, can you just cover my whole scalp, make my hairline and fill my whole scalp with very dense hair in one sitting? Well, I tell them no, it's not possible. You need to go in for at least 2 to 3 sittings to cover your full scalp. Then the next statement they tell me is, the doctor, so and so other doctor was telling me that I will cover your full scalp with 5,000, 6,000 grafts in one sitting. Caution, beware, this is very dangerous. It is impossible to cover your whole scalp in one sitting if you are going for the FUE procedure. If we go for a FUT and FUE procedure together, then of course a larger area can be covered after a hair transplant surgery. But remember, with the FUE procedure, in one sitting, we can only consider one part of the scalp, which is the front area. To make it more clear, let us divide your scalp from the front till the top. The top area is known as the crown. So from the front till the top into 3 zones: Zone A, Zone B and Zone C. You take the 4 fingers of your right hand, keep it in the front, make it as Zone A. Take it in the center, this is Zone B, and take it at the back like this is Zone C. In one sitting of FUE, if done properly, we can only cover one zone, that is Zone A. Now you would ask me that why cannot we extract more grafts and cover Zone A, Zone B and Zone C together? Simply because there is a concept which is known as the safe donor area. What is a safe donor area? Well, we all know that in a hair transplant surgery, the basic principle is that hair follicles are extracted from the back of the scalp and implanted in the front or the top bald area. Why the back? Because if you notice around yourself, you will see, just pick any bald person around you and you will notice that no matter what age or stage of baldness that person is in, a strip or an area of hair at the back is always spared. That area never becomes bald. Here in this area you will always have hair. Well, this is because the roots at the back of your scalp is resistant to a hormone which is known as the testosterone hormone, and it is even resistant to your genes. The hormone testosterone is responsible for causing baldness, and of course your gene is gene, as in if anybody in your family member is bald, then those genes from that family member can come into you and that leads to baldness. So the hair roots at the back of your scalp is resistant to both testosterone and your genes. So we simply extract hair follicles from this resistant, dense, permanent area and implant in the bald area. Now, what is safe donor area? There is a method of mathematically calculating a zone at the back of your head through some measurements and some bony landmarks which we do before we start the hair transplant surgery to demarcate or mark an area which is in the shape of a parabola. That is the safe donor area. If you go above or below that parabola or that marked area, then what happens is definitely you end up extracting more number of grafts, but the result is not permanent because that is the unsafe area which is liable to fall in the future because it is not resistant to the hormone and neither is it resistant to your genetic makeup. If you stick to the safe donor area, then it is impossible in any circumstance to extract more than 2,500 to 3,000 grafts in a simple FUE procedure. Now, I was talking about the FUT procedure. FUT is the strip procedure where what happens is a strip of skin is cut from the back, from the center, and then grafts are chopped off from that skin. The area at the back from where we take out the strip, there stitches are given. So you end up with a scar. I do not advocate a strip procedure. In fact, world over, there is a significant shift from the strip to the FUE procedure for the simple reason nobody wants a scar at the back, or nobody wants to become beautiful by having a scar. Of course, the complications, the pain, everything is more with the strip procedure. So I would advise go for just an FUE procedure. And if you go for just an FUE procedure, then extraction of more than 2500 to 3000 grafts in one sitting is impossible. If your surgeon is trained and qualified, the surgeon will not exceed this count. Now, if you have to cover the full scalp by the FUE procedure, then what to do? Space out your sessions. Go for multiple sittings. So if you have to cover all the 3 zones, zone A, B and C, then you need ideally 3 sittings. 3 sittings spread over a gap of 1 month each by our procedure. The procedure what we do is the latest in the medical field. Here, the size of the punch which we use to extract the graft is very small. So your donor area heals maximum within 1 or 1.5 months. So we call you for the next sitting after 1.5 months or 1 month, depending on the rate of healing of your donor area, and then we go for the next sitting. So if you have a good, decent, dense donor area, then in one sitting you can go for 3000 grafts, that covers your zone A. In second sitting, you can go for another 3000 grafts, which can cover your zone B. In the third sitting, then you can go for maybe a lesser number of grafts from the scalp, maybe a 2000 graft session, plus you can go for body hair. Body hair, as in I personally prefer the beard area. Beard area is an excellent area to extract graft. So a combination of a body and a scalp hair in the third sitting. This plan overall is what we follow to cover your full scalp by the FUE procedure. I call it advanced FUE procedure because we use implanters to implant the grafts, which hardly few doctors throughout the world use. So whenever somebody tells you that I will cover your full scalp in one sitting of hair transplant, beware, they will damage your donor area and they will leave you with something known as a moth-eaten appearance. Moth is a worm which eats the leaves and makes it look very gross. That is what happens if overzealous and over aggressive extraction is done from your safe donor area. I hope this little piece of information which I have given you today will help you in making a decision when you are going ahead with the hair transplant surgery. In case you have further queries, questions, please come to my clinic or contact us in the number which is written in the caption below. I will be more than happy to help you out. Thank you.